Hello there, guys. Welcome. We're about to see another episode of Dr. Lynn in action, multiple runs to the ER, etc. Enjoy it.
I'm super morbidly obese. I don't want any advice. I don't need advice.
Stop the cap.
I don't need doctors.
Oh, really dumb. For real.
I don't need anything like that. Everything that could be possibly said to me right now is already obvious, so don't waste your breath. I'm filling out so much information, and this made me really sad. This is a depression thing that they want you to fill out, and I put 3 on everything besides the last one. She said be as honest as possible. Oh wait, there's a 10th question. If checked off any problems, how difficult have these made it for you to do your work, take care of things at home, or get along with other people? Extremely difficult. We were just talking about that last night. So far, I've only seen the nurse, and she's been great. So another update, I just talked to someone else, and they want to put me on some depression medicine. I'm going to be doing labs today, because technically I have fasted. They asked last time I ate and all that, so, which has been since last night, because again, I don't like to eat when I first wake up. A lot of people think I'm lying about that, but I'm not. So we're going to do labs, and they said they're going to be able to check for everything, because I have yellowing of the skin, which you guys have noticed, I've noticed. So they're going to be able to look at my liver, my gallbladder. They're going to be able to check for diabetes, if I have a thyroid problem. God, what other stuff did she say?
I can't remember.
So many different things. They're going to be able to just knock all that out. So we're going to see how that goes. What else? I think that's about it for now. So we're just gonna wait, sit here and wait. I'm very nervous to get poked with a needle because I don't like it. My experience overall was so good. I'm the type of person, I go off of vibes. I'm a very vibey person. Like, if you give me a bad vibe, bye. If you give me a good vibe, hi. Every nurse and the doctor I talked to, they were also kind and caring. It was like I was the only person in the world. That's good customer service. Like, they really truly acted like they cared about what was going on. And I talked to them about a lot of different things, and they didn't just have a focal point on one thing. They cared about everything, and they were patient and just kind, and they were funny. It was just a great experience. That I did do lab work, so they did take my blood. They're supposed to either call me tonight, tomorrow, or on Wednesday. So the next 3 days I will get a call if I either have diabetes or have a thyroid problem or something's wrong with my liver, something is off. They will be calling me. I'm expecting a call. We're all expecting a call. Us, my haters,
I'm here to tell you right now, we don't care.
Let me tell you.
the supporters. I can't be 100% healthy at this weight. It's just not possible. I'm nervous. We'll see. I feel very antsy. When they checked my blood pressure, it was normal, which kind of shocked me because I have had like kind of high blood pressure before. It was very high when I took phentermine, but I was kind of glad about that. My doctor, which I can now say I have a doctor. This feels awesome. Like, wow. My doctor is actually calling a therapist for me, and the therapist is supposed to call me and tell me when the appointment is, etc., etc. So I'm pretty sure I'm going to be seeing a therapist, which makes me nervous as well. The big thing here is I'm on meds. I'm trying not to show like my name or anything.
Girl, you're like 6 years too late for that.
I had to get those today. They're antidepressants. I knew I was going to cry. I knew it. I fucking even cried when I was talking to the doctor. My depression has been really bad, and I've been living with it silently for, I don't know, last few weeks has been horrible. I don't know why. And it's hard for the people around me. It's just been really hard. I have really bad, crazy mood swings with it. And when I talked to the doctor today, I was very eye-opened that a lot of the things that I do on a daily basis is because of my depression. That like opened my eyes a lot. I'm glad I have an answer for why I don't sleep well, or why it's hard for me to concentrate, or why I have these mood swings, or why I overeat. Obviously, there's more to my overeating than just depression, but it's just crazy how much can happen when you have depression. So I'm actually really scared to be taking pills. I don't like taking medicines, as you guys know. I got a lot of paperwork to do with the antidepressants that I will be taking, and it scares me because on every page is just all this negative stuff. It's like, this pill might make you feel worse. This pill might make you have suicidal thoughts, which I've gone down that road, and I don't want to get worse. And I try not to show my depression on YouTube. I want this to be a positive environment, but I'm being very raw with you guys right now. I told the doctor, I feel like there's times where I feel like the world is better without me. And I don't want to get worse. And supposedly this pill is like, you can have seizures and just all these really bad things can happen. Okay, I don't know what just happened, but my camera died, and I talked for quite some time and I ugly cried. Maybe I'm glad that wasn't filmed. It's just that this pill has a lot of bad symptoms.
Side effects. Symptoms are from disease.
Helps some people, it doesn't help other people. I'm just very scared that it's gonna make me feel worse because that is something that can happen. For this pill, it takes 4 to 6 weeks to work. I'm taking it 2 times a day, 8 hours apart. I have to take it with food.
For psych meds, it can take up to 3 months for them to make effect, and then not always are you gonna respond to them. Sometimes you have to try different ones. There's different types of antidepressants, so you may have to try 2 or maybe 3 different ones. It's like a real roller coaster, honestly.
So I'm gonna take it right when I wake up, and then I'm gonna take it 8 hours later because it's actually supposed to make sleeping harder. They know that I have problems sleeping already, but that also has to do with my depression. Me having really bad sleeping schedule is part of my depression. So hopefully if this pill does work, it's going to balance everything out. I'm hoping. I'm going to actually try journaling.
So in Ambi's case, this was before her bipolar diagnosis, so the antidepressants were actually never gonna work anyway.
Privately about how I'm feeling, because if I start to feel worse, I need to know this. I need to document this because it could be the pill making me feel worse. I'm going to start taking it tomorrow, and I'm just hoping for the best because I really am tired of feeling this way. I know you guys don't see it really in my videos.
Oh, I'm actually feeling bad for her in this one.
But I have a whole different side of me off of the camera, and it's things that I don't want to share or talk about because I feel like ashamed and embarrassed that I have such bad depression. And I feel like a lot of people think that like depression is just an excuse to be a certain way. As a lot of you know, I sleep until about 2 p.m. But why? Why do I sleep until about 2 p.m.? It's because I don't fall asleep until sometimes 9 a.m. Most recently, it's been about 6 a.m. So I'm getting a little better.
That's wild, and your body never gets used to that.
But why can't I sleep? And I'm just very grateful I saw a doctor today because they were able to answer these questions for me and be like, we're going to put you on an antidepressant and we're going to see if this helps you. And
that's the thing with bipolar. You can't get diagnosed for bipolar the first time you go depressed or the second time you go depressed. It has to be a cycle of the ups and downs for them to actually realize that there's a pattern. So it's complicated.
I'm just very grateful that I have Becky here and I have friends and people who are here and they can help me also see, like, Amberlynn, this pill is helping you. So I'm hoping after the 30 days, which will be after 4 weeks, I feel some type of difference. If it's negative, I'm gonna have to switch the medicine, and if it's positive, I'm gonna keep taking it. But I'm scared and I'm stressing a lot. I love being a YouTuber, and it sucks that the following I have hates me so much. I feel like I'm the most hated person on YouTube, and I probably am. It just sucks that so many people out there want to see bad things happening to me. And it's like the things that I have to read is just unbelievable. I can't even read the comments anymore because it makes me sick to my stomach, and it's not helping. I'm never going to get better if I surround myself with such just bad vibes, and I don't want that for myself anymore. And it just sucks that there's so much around me, revolved around me, online, where people think like these things about me are true when they're not, and it sucks because there's nothing I could do about it besides just ignore it. I just really want to fill myself with positive space, and I just want to get better. I don't feel motivated to do anything anymore, and it's all because of the depression. And I don't know, I'm just very happy that I saw a doctor today, and I'm super nervous to see how the lab went, and I'm just hoping for the best, and I just want a bunch of like positivity. I feel like I deserve that much, I guess. Positive thoughts. And if I do have diabetes or there's something wrong with my liver, because I told them about the yellowing of my skin, it is my fault because I pretty much have ate myself to death. I think now is the time to just fix my problems. And I have a wonderful doctor who is super sweet.
But the problem with Amberlynn is that she just talks about it and doesn't actually ever do anything, and that's just not gonna help. Bipolar or not, it's just never gonna be a good thing.
Nurses who are just so kind. And I have a girlfriend that's patient and there for me and cares about me. So now we just gotta work on those YouTube comments, and I don't know. Oh, that'd be loud in my ear.
Thank you for calling Lynn, Urology Sundays. Our normal business hours are Monday through Friday from 8 to 4:30 p.m. We are currently closed for the holiday and will not be here to take any calls. Please do not leave a message.
Please do not leave a message. I'm actually about to go to the hospital, to the ER, because that pain is still there in my back. Of course, it's nowhere near as bad as it was, but it's like a constant dull ache in my right lower back, kind of where you'd get some kidney pain.
The ER just hates to see her coming.
So I, for one, am worried, and I want to get that checked out or just see what the hospital says. It is midnight, so I'm going at a time where not a lot of people are usually there. So I'm going to try my hardest not to take up anyone's time. I just know that if something is wrong with my kidneys, I better nip it in the butt now. But that's just where my head is going and where I'm worried. It could be a UTI. I've never had one before, so I don't know.
But do you need to go to the ER for a UTI? Like, why not make an appointment and go to the regular doctor? I've been to the ER twice in my life, and it was because I had some, like, crazy-ass tachycardia. My heartbeat was, like, 180. So I did think I was having a fucking heart attack, and I wasn't.
I'm just really nervous. Okay, so I got my blood done. I had to pee in a cup. And I was really scared. It really was. For some reason, like, my kidneys were just in my brain.
I don't think they were good. You would have gone in surgery.
Really bad. And I've never suffered with, like, a UTI or a bladder infection, which is the same thing, pretty much.
Nope.
And, so I was scared. And I get back pain a lot, and this didn't feel like any back pain I've ever experienced ever. So I knew something's a little off. I kept telling people that in my life. I was like, this isn't the normal back pain that I usually get. So I was definitely freaking out and worried about it. So after they did the test, the doctor came in, and he came in and told me I have a gnarly bladder infection.
I wish there was like an archival counter of how many bladder infections Amber has gotten over the years.
So this is the first time I've ever had one, and
not the last.
He explained to me like how people get it and why.
They don't wipe right and they don't wash right.
And prescribed me some medicine, and I got 2 shots to the hip. How's your chest?
It's good.
You're breathing?
It's short.
Yeah, it's short still. The lung doctor has not called her yet. They said between 7 to 10 days, and it's been, 8 days now? So they haven't called. I told her since today's Friday, I don't know if they're open on Saturdays, to call on Monday and make her own appointment. Like, doctors need to get their shit together.
Dr. Lynn?
I saw 2 doctors regarding my symptoms, and they both said something completely different.
I think if you go doctor shopping and tell them different versions of the story, yeah, they might come to different conclusions.
I mentioned seeing a 3rd doctor. So it's May 29th, and I went to the hospital last night, and so I'm just gonna kind of explain what happened so you guys kind of know what I'm going through. I've been having female problems for a very long time, and I've done so much crying, it's like the tears don't want to come out anymore. So I've never been to it, and I know when that's my fault.
Girl, you're at the ER every weekend and you've never been to it, kind of?
Get it? That's very apparent that I've done this to myself. So last night I went to the bathroom and I went pee, and when I stopped peeing, there was still stuff coming out of me. It sounded just like I was peeing. I went to stand up, and the whole toilet was filled with blood. I have never seen anything like it in my life, and I took pictures. I wish I could post them on here, but
why?
I mean, I can't, obviously, because I don't really know the guidelines regarding that, but I knew right then and there I needed to go to the ER because I can't even put into words how bad. So when I would walk, it was falling down my legs, and when we got to the hospital, I wasn't able to walk. They had to put me in a wheelchair.
It's okay to keep some stories private.
I just want to say foremost, right at the beginning, a lot of doctors helped me today, last night. And, there were some really kind people. And I feel really bad. And I kept saying that because in the ER room where they were, trying to figure out what's wrong with me, I had blood everywhere. And it was terrifying. And I also have pictures of that. And, some of the nurses seemed shocked, which scared me more. And, there was, this is TMI, I'm sorry, but there was like, oh, I don't want to show my wristband because that's personal information, but globs like this falling out of me of, I don't even know what, I guess tissue. And it was just like I was peeing. It was so scary. So I was sitting on the bed and I felt something on the side of my leg. And I said, Becky, can you come look? And how do you even explain this? Like, it was so bad that it was now seeping through every part of me. Wait, that sounds not out of my body, but like the tissue was now coming out of my pants.
It's so gross, but I'm too invested. I can stop watching now.
I can't even explain it. Like, I've never in my life. And right then and there, I started panicking. I was so scared. I pressed the little alert button or whatever, and the nurses came in and they were like really freaked out themselves. But they had to try their hardest to put on a face and make me feel better. And I feel so bad because there were so many times people had to come in and clean.
Healthcare workers really are heroes.
The whole floor. So, I got my blood taken several times, and, finally a gyno came in. OBGYN, I would just say gyno, huh? And she scared me a little bit. That's okay. She said she was gonna put me on a medicine and see if it'll stop the bleeding. And once it did, she thought maybe possibly I would go have surgery and have a, what is called, babe?
DNC.
DNC, where they're scraping my uterus. And I'm not a doctor, so if I'm misinforming, I'm sorry. I also got an ultrasound done of, was it my ovaries? My ovaries.
And your cervix.
And my cervix. So, in the ultrasound, they were able to see that I had thick tissue.
Every word she says is grossing me out. Even thick, it's like, ugh.
So, another was, you think he was a gyno too? He was like a surgeon.
He was a surgeon.
But he knew what he was talking about. He came in very, very stern, very serious, and straight to the point. And he said, you're gonna have to have surgery right now. And he canceled several people's surgeries because mine was emergency. And he literally told the lady that if I don't get surgery, then I'm just gonna be in the room to die. And that was terrifying to hear. And I don't think he knew that I heard because he said it out in the hallway. But he seemed like he truly cared. Really, truly. And he said that by doing this, he's going to take off the tissue. It's supposed to supposedly stop the bleeding. And he's going to test it because it might be cancer.
Okay, now I feel bad about making fun of her. Oh. No, it's fine because we know she made it. She's good.
So I'm freaking out. Like, terrified. because I've never had surgery before, ever. And, at my size, obviously, it's a little, scary because you hear really bad things. And, long story short, I did have a surgery, and, it felt like it happened within a second because anesthesia, obviously. And, they took really good care of me. Afterwards, they told me that I do have sleep apnea.
But this is the second time she's being told by doctors that she has a sleep apnea. Why is she so shocked? The lady doctor that invited her to the weight loss challenge also told her so.
I've never been tested. And, while they were doing the surgery, I would stop breathing a lot. Another thing is they had to cut my hymen high. That's embarrassing. And, he had to do that to get to where he had to get, you know.
Where he had to go.
Yeah. And, he ended up stitching it back together, which I don't think he didn't have to do that, but I don't know. Like I said, I don't know much about anything. But it's been scary, and I do want to say that I'm still bleeding, and I think that's why I was super scared. And he told me that I'll get the results next week if I have cancer. And he was very to the point, and he didn't sugarcoat anything, which that's what I need. And I'm just so grateful that he really cared. But I'm scared. So I was in the hospital for quite some time, and they watched over me after the surgery for a while. I'd say about 10 hours. And the nurse I had was so helpful. Now I'm back home, which scares me. Because I'm not under, the supervision that I wish I could be under,
That's it for today, guys. Like and subscribe, and thank you for watching.